Hi, everybody. Welcome to tonight's program of Coach Menachem Berfeld. Thank you for joining us on this beautiful Sunday night. Tonight is Shir 240. So first, I start off every Sunday night thanking the people for posting it and putting on the WhatsApp statuses and telling people about the amazing program. Friends and families, we have an amazing lineup coming up, a bunch of speakers. So please get into it. It's like Rabbi Moshe Weinberger says, Rabbi Binyamin Tepfer's share. It's a sichas chaverim, a place to really speak through things and to really get some clarity in Yonam. If anyone wants to join our WhatsApp chats, you can please WhatsApp me at 732-314-1710. I'll also send a link to the group chat as well, and you can be part of that. Thank you to all the advertising sponsors, the Lakewood Scoop here in Lakewood, Elianera from 5 Town Central, and Chai Lecom from JCN. The Coach Menachem Show is sponsored by OKClarity.com. OKClarity.com is the largest mental health and wellness directory of the global Jewish world. It's the only place any Yid, a Jew, to find amazing therapists, psychiatric medication provider, nutritionists, and yes, you can even find Coach Menachem there. OK Clarity has amazing WhatsApp status of over 10,000 followers, and it's great for the mental health as well. They post a lot of humor, and we'll put all the links to OK Clarity in the emails we receive after the show, so you'll get that. Again, for anybody who's here the first time, every Sunday night at 9 p.m. on the Zoom ID, we have different topics, different therapists, different rabbanim. Next week, we're going to have an amazing show with Rabbi Abichai Cohn. He goes really, really deep if anybody knows him, if anybody heard anything from him, and the topic is going to be a very powerful topic. We're not going to announce it yet because we're still working through it, but please join us next week. It should be something amazing. Okay, tonight's share is 240, and we're going to give you the gematria of 240. We're going to turn it over to Erna Fried. Tell us what we're doing here tonight on this Sunday night.
Shalom Uvracha, everyone, to Zoom share number 240, Broken Open, covering the essentials of trauma healing. It's our hope, Be'ez Hashem, with tonight's Zoom share, to take those in need to a much better place, a caring and loving situation, which leads us up for tonight's Gematria 240 equals Mokoim Chaviv Kazeh, such a lovely place.
Beautiful.
Beautiful gematria. Okay, we're going to turn it over to Coach Menachem. Same question we ask every Sunday night. What are we doing here Sunday night? So many other things to do. What are we trying to gain tonight? What are we learning tonight?
Yeah, thank you very much. Welcome, everyone, to another Let's Get Real with Coach Menachem. And a lot of Siyata Shmaya, Shkoyach, Harnoech, the Gematria. I want to welcome Dr. Binyamin back. And like I told you, we're still getting feedback from last time. I think it was in 2021 then. Baruch Hashem, and excited to continue the conversation and to see what we can help, how we can help. So this week was Shabbos Nachmu, and I hope everyone had a beautiful Shabbos Nachmu. But we're talking about Nachmi Ami. Hashem tells Klal Yisrael to have a Nechama, and this is a question I had many years, I still have, and I think a lot of people have. Every year after Tisha B'Av, after the 9 days, 3 weeks, Hashem says you have a Nechama. If you think about it, Klal Yisrael went through a real trauma. And Charban Beis Hamikdash, not everyone is connected to it. Not everyone feels it, but we have to remember we're in Golus. And being in Golus itself, if you think about it, we don't belong here. And we daven every day, L'Shalayim Ircha. So in a way, the question is, what's the Nechama if every year again? And it's hard for many to connect. Some don't want to think about it. So everybody, wherever they are, but there's a lot of different terutzim, answers that they answer, whether as you get them, whether to understand that it was the toiv, or there's something coming out good, something good out of it. There's a purpose, connection. Some people say you find a deep, deep connection. And Tisha B'Av itself, when Mashiach is born. So there's a lot of different answers, but I don't want to go to the answer yet. But the question is a very powerful question. And many times when a person goes through a trauma, you can try to tell them many good ideas and many reasons of why, we'll be discussing tonight, broken open. to find a little bit of good, but it's possible that you're in a place where I don't want to hear it. I can't hear it. It's too painful. And when you start, explaining and understanding, you just shut down. And that's what it says, when somebody else comes for help. Sometimes all you got to do is listen. Not always that easy, because it puts you in an uncomfortable spot when somebody shares their things, when they share it with you, and you're like, what am I supposed to say? Wow, it's very hard. So you try to start saying, Yasher Hazai, Yasher Hazai. Not always is that the right thing to do, to be able to listen, really listen. And it could be hard for the listener. But, tonight we're going to be talking about trauma. Trauma is something, could be many different traumas, many different things, from the smallest thing to, who knows, Hashem Yerachem, things that are hard to talk about. And if somebody went through or is going through, sometimes it's just too hard. So, before we start, it's okay if you can't listen, and many times you have to come back when you're ready. But our hope is, and our tefillah is, that we should be able to try to find something, no matter where you are, beginning, what level you are, if you could listen or not, if you could understand what the topic is, the discussion. And Hashem should help. Hashem should help. And it's Hashem. It should be with Hatzlacha, and that's a lot of siyata d'shmaya, shkoyach.
Koyach, Menachem. Okay, let's get into it over here. Here we go.
Okay, thank you.
Just 1 second, Rabbi Yom, I'm going to read your bio.
Okay.
I want tonight's share to be schus. I had my father's yard to Shabbos yesterday. It's schus Moshe Yom ben the Shmuel, the Shomash Rabban Aliyah. Shem for all the people that are coming here tonight and getting chizik, and all the thousands of people that are close to it. Dr. Binyamin Tepfer, PhD, is a licensed psychologist and founder, the clinical director of Tepfer and Associates, a private practice locations in 5 towns, Brooklyn, via telehealth. He also serves as a certified CSAT supervisor for Internal Institute for Trauma and Addiction Professionals. His specialty areas include the treatment of trauma, addictions, and marital intimacy. Rabbi Yoma was on once before a while ago. We had an amazing share. It's an honor to have you back. The floor is yours.
Thank you so much, Roshi Menachem, and everyone, because it's a privilege to be part of this, be part of the special program and all the wonderful things that you're doing. I want to start. I don't think there's a better time to be talking about what we're talking about than right now. We all just literally got up off of the floor and we went for a Shabbos Nachamu. And that's tonight's topic. Tonight's topic is to explore broken open, meaning what is it that we can do? What is it that we can hope for in terms of looking at our brokenness individually as a people? Some people have capital T's. There are a lot of tremendous, big, specific traumas. Some people have a long history of just growing up in a situation, more of a complex PTSD situation, which means that there was ongoing situations that may have not been one specific thing, smaller T's that added up to a lifelong that led up to different things that they're dealing with. I want to start off with an observation or a question, and I think that in the few minutes that we have as an introduction, we'll try to answer it the best we can, and then have the Olam jump in. My question is that as a people, we have suffered, we have been exiled, we have lost a tremendous amount compared to any other people. We've gone through a lot in many, many different ways. And if you look at us yet, there's something very, very remarkable that as a people, we all know we're a resilient people. We're a people that not only has survived, but has somehow thrived, has gotten up off the floor, literally, for 60 or 70 years ago, over and over again in our history, and to rebuild in so many different places. And of course, we have our scars, and of course, we have our post traumas that are affecting us. However, there's something very, very remarkable. they did an interesting poll I came across a few months ago. They were polling who is the happiest countries in the world? Where are the people the happiest? And this is after October 7th. Israel, out of the, I think, 160 different countries, was number 5 out of 160 something countries. Now you think about that. How are they a happy people if they're living, right, with whatever they're going through on so many different levels? So my question is, does our people have something that we can try to uncover that tells us about being broken open, the essentials of trauma healing? That's observation number 1. And I want to bring it to the individual as well. Many people go through difficulties. I sit and I'm talking to people really all day about different situations. And we find that some people are able to go through difficulties and are able to emerge with the help that they need, with the support that they need. They're able to emerge, and not just emerge. When someone goes through something difficult, like we say, Sham Kanisa, there's a strength and a beauty and a resilience that those people have that another person does not have. While other people somehow are we can't compare people, but other people get stuck and stay in that blaming or victim mentality and aren't able to emerge. The question is, what differentiates us as a people versus other cultures, individuals that are able to go through difficulties? And there are so many different approaches to try to heal trauma. Those that are a little familiar, I'll name a few of them. There's EMDR, where you're able to go back to memories and with bilateral eye movements. There's somatic therapies using the body and the different feelings in the body. There's more of the cognitive approaches, how you're thinking about things. There's internal family systems going through the different parts within a person and different exiles, parts of us that we don't want to face. There's a more psychedelic work these days to heal with trauma, which we could talk about for a minute or two. But I think that if we boil it down, these are different wrappings. These are different approaches that sometimes speak to different people. But in essence, there are 2 main things that emerge as commonalities in all these different approaches. And I think it's with us as a people and the individuals that are able to rise up, again, with the help, with the support, and at the time that they're able to. No one's thrusting this upon anyone. And I want to uncover what those 2 things are. And I think it's going to be something very, very useful for each of us. I want to give practical examples of these 2 different things as well. So what are these 2 things? So number 1, when a person goes through anything difficult, any challenge in life, any loss, what we know is that it's not just the difficulty and the challenge that we're going through. It always comes along with a way of thinking, a certain closed, a certain trapped, a certain dark place that our thinking goes into. In the Svarim, they'll call it like a moichin de katnos. Our thinking isn't expansive, isn't very, very broad, isn't very, very big, but it ends up being very, very narrow. So I'll give you a few examples of people going through difficulties. So these are some of the things that us ourselves and people that we're listening to, friends, if you're listening to Talmidim, or if you're listening to clients or patients, or our spouses, or our children. Some of the things that they'll say is, I'm the only person in the world that is going through this thing. Everyone else would never deal with this, is not needing to deal with this, doesn't have it this bad. There's a certain narrowness and isolation that the person feels in what they're going through often. Another thing that the person will feel is, this thing is never going to end. It's not just I'm going through this for the next few weeks or months. There's an endless quality to it. There's no hope. It's going to go on and on and on forever. Another thing that the person will feel is that, there's no point. There's no point to this. There's no meaning. There's no purpose for this. It's for nothing. And these types of mindsets, when we're going through difficulties, not that we don't just go through, again, the challenge of whatever that is. If it's a loss, if it's a difficult relationship, it comes along with a way of thinking. It's called in Yiddishkeit, it's called a tzara, right? Tzara comes from the word tsar. It's a very, very narrow way of thinking, of seeing, of feeling, of experiencing life. And therefore, the very, very first step in any modality is always going to be, there's the need for that individual to try, with the help of people, with the help of trying to get to a bigger mindset, to try to get some context, some vision, some objectivity, to get out of that trapped way of thinking, of seeing, of feeling in his life. So I remember I was reading some of the works of a great psychiatrist, Viktor Frankle, and he wrote a lot of different books. The most famous is Man's Search for Meaning. But in one of his other books, he was writing that when he was going through some of the most difficult things, he went through the Holocaust, and he survived, and then began a whole field of psychology called logotherapy. And he said that when he was going through some of the darkest periods of time, he said he simultaneously always envisioned and always imagined himself afterwards on the other side of this terrible dark period of time, and what it's going to be like when he's going to teach and talk about how he survived. So simultaneously, he was in the darkness, but he somehow always had this like futuristic, bigger ability to know and to feel that there's going to be an after, and that he was like standing in front of a lecture hall talking about this time. So he wasn't just stuck in it. There was a certain vision, a certain place that he was able to expand himself to. And I was thinking, when we go be Menachem of someone, you'd think that it's very insensitive what we say, and of course it's not. But what do we say to a person who just lost someone? We say, Hamakom Menachem, right? Besoch shara velitzi in Yerushalayim. Why do we say that? What we're telling the person is that you're not alone. There's a feeling of loss that's so alone. And we're trying to get that person in a very, very small way to understand that there's a brokenness in the world that we're all feeling in a certain way, in different ways. And therefore, don't feel that. So we're trying to give a context to that person, to get to a bigger place. I'll give you a few other examples, practically, how this comes out in many different subfields of psychology. So there was a writer and a practitioner named John Kabat-Zinn. He introduced mindfulness to the Western countries. A very big, influential. Technically, I think he's a yoga teacher. I don't know if he's in the mental health field as well. And one of his tremendous breakthroughs was he would teach people to do a body scan, people who were feeling a lot of chronic pain in one area of their body. Let's say a person had a terrible back, or a person had a pain in their knee. What often happened was that it became chronic, and the person for 10 or 15 years couldn't get rid of that pain. And what he realized was all the person is thinking about in his brain is that place that hurts, that place that, and you literally forget about the context of the rest of the body. Through his body scan, he went to different hospitals and he studied this, and there's tremendous research behind it. He made a person practice awareness of their entire body, the full context of their body. And one of the things now is the pain that they're feeling in the context of being aware and being present and embodying their entire body. So the body scan makes a person feel and be in touch with the sensation of their entire body. And slowly but surely, that pain now is in the context of a larger experience of the person's full body. and that changed it. One of the things we spoke about in, I think, 2021, I'll just briefly reference back, is the work of ketamine when it comes to treating trauma. And all psychedelics, ketamine in specific, what they do when a person goes through that is it pulls a person out of the specific traumas that they've gone through and gives this person this sense of like a greater whole of the universe that they're part of. And then it puts the trauma that they were in the context of this biggerness, this largeness, this existence that they're a part of, that then helps them begin the healing of their trauma. And because now there's a context, it's not just a smallness, a narrowness. So we're going through it fast, but that's point number one, that there has to be, we want to introduce vision again, something that your trauma is part of your own life, something bigger in your own life. It's not just the be all and end all, the only thing. There's meaning to life. There's a before and there's an after. There's other people. There's a bigger world. And your trauma is a part of all of that versus it being the only thing that you're able to see in front of yourself. So one of the things that are helpful is also a timeline of a person's life, or a trauma egg, putting this trauma event in the bigger picture of my entire life. Now, number two is very, very different than number one. The other challenge of anyone who's gone through trauma and difficulties and loss is the opposite. There is a tremendous pull and need and attraction to escape, to numb, to disconnect, to disassociate, to avoid the overwhelming feelings that the person feels when they remember things, or when they go to certain places, or when they speak to certain people. And therefore, they either want to avoid places or people, or they'll go there or speak to those people, but they'll literally disconnect. They're not in their body. There's like a line that a person is literally living like 3 feet away from his body or her body throughout their entire life. They don't actually live and feel life as it's going on. So their responses, you'll hear things like, that was nothing. I'm fine. Nah, didn't really impact me. It didn't make a big difference, you know. And these are things that are big things that happened, but they'll literally be very, very slow or not react at all. There's like they're very objective people. Everything is like a meta experience to them. They're always, you know, subjectively, they're not in and feeling, whether it's angry, whether it's sad, whether it's ashamed, whatever it is, whether it's lonely, they're just skimming the feelings of life. And this shows up, of course, tremendously in the close relationships that these people have, marriages, with their children. And here, the work is, and this is the second stage of trauma work, at the right time, the work here is to bring that person into, in the right way, in a safe way, with the right supports, with the right container, back into experiences. Some of them that are difficult, that they've never felt, that they've never been able or willing or courageous or capable to go to with an open heart and with an attunement to their body of what it actually feels like to feel the experience that the experiences that they've gone through. There's it says in the Mishnah by Morer, it says Bala Morer, if a person just goes without chewing, he just swallows the Morer, lo yatsa, right? It says he doesn't fulfill it. And as far as I'm explaining on that if a person tries to just swallow the Morer of life without tasting it, lo yatsa, you'll never get out. You'll never ever get out and emerge from that trauma, because what will happen is you're never feeling it and felt it to process it to then emerge from it. And we know the only way out of traumas is through it. It has to be at the right time, in the right way, actually experienced and felt in a real way. There was I'll tell you, I'll take another just minute or two. Elie Wiesel was a famous author and writer, and he was a survivor of the Holocaust. And there was a famous meeting that he had with the Lubavitch Rebbe. I think this was in the 60s or 70s. And they spoke for many, many hours. And at one point, Wiesel wrote about this meeting. You could find it online. Towards the end of these hours, the Rebbe looked at Wiesel and said, "So, what do you want from me? What can I do for you? What can I give? What can I offer you?" And Elie Wiesel said he thought, and he said, "If the Rebbe can give me one thing, I would ask for the ability to cry. I haven't cried," he said, "since I went through what I went through. The world of my feelings, my heart closed, and it needed to. And for the past 20 whatever years, I haven't been able to cry." And the Rebbe thought for a minute, he said, after he asked that. And he looked at him, he said, "I'll teach you to cry. But that's not enough. And I'll also teach you how to sing and how to laugh as well." And Wiesel said in that meeting, that's exactly what he did in the remaining time with the Rebbe. For the first time in his life, since he survived and left that terrible and dark place, he was able to cry and he was able to laugh. And what the Rebbe was saying is that if you go through traumas and you're not able to feel, and the time isn't ready maybe for you to be able to feel, there's a shutting down of the water main. And it doesn't just mean you can't cry or you're not feeling the trauma. We don't either fully laugh, and we're not fully connecting, and we're not fully reacting, and we're not being authentic. We can't be. And therefore, the second ingredient that's found in all trauma work is going to be the safe reconnecting to what it feels like to have lived through the difficult things we lived through. And there's many ways of doing this, through obviously therapy, experiential therapies, journaling in a very, very raw way. There's tracking that we do following, in somatic type of work, many, many different modalities. But in its essence, it's the other side of the coin. One side of the coin of trauma work is not letting a person be stuck and flooded only by the narrowness of what they're going through. So it's giving them context. And then it's also the ability to be able, in that context or with that context, to put that context aside for periods of time, to be able to immerse into the experiences and the feelings with our full bodies, with our full emotions, to be able to then emerge through it with context in our life and with the ability to be in touch with our bodies and our feelings and our memories in a whole type of way. So that's the brief introduction to tonight's discussion of Broken Open. And I hope that these two parts of the title now make sense. There's the need for an openness, for an expansiveness, and also a need for a brokenness. And they both go together. And trauma, hopefully, leads us to a healing place of being broken open.
Okay, beautiful opening. Okay, let's go to the polls again. Anybody who wants to ask Binyamin a question, please text over here. Shaparnas. Live questions go first. Let's go to a 3-question poll. Everybody answer to the best of your ability. First question. When it comes to past painful experiences, which best describes you? 3 options. I tend to revisit and think about it often. I avoid thinking about it as much as possible. I'm not sure which is healthier for me. Second question. Do you believe the Torah and Chazal directly address trauma and emotional healing? Third question. When you think of healing from trauma, which do you believe is the most important? Number 1, processing the past. Number 2, learning coping tools from the present. Or number 3, rebuilding hope for the future. Okay, everybody answer those 3 poll questions. We'll give you a few more seconds, and then we'll review it together. Anybody wants to ask a live question, please text. Five, 4, 3, 2, 1. Okay, let's review this with everybody. First question, when it comes to painful experiences, which best describes you? Binyamin, you pretty much have a split over here. Some people, they think about it again and again and again, and the other half of the people basically avoid thinking about it as much as possible. 40% revisit it, 40% as much as possible. 20% they're not sure which one is healthy for me. But you see, it's a very clear split. What's your
Yeah.
take on that?
Well, so and I think that really 1 and 2 they go together, and I'll tell you why. Because some people, we can understand the first choice in a few different ways. I tend to revisit and think about it often. It'll replay. It'll come up in my head over and over again. This difficult thing. The reason why that happens is because it was not properly processed, and I will revisit and go over things because they're just touching, my mind and my feelings, and then I'll go to avoid them. So people will revisit it, but not really get in to the kishkis of it in a proper way. And if a person does, what ends up happening is the person stops revisiting it over and over again after it's processed well. It's the person doesn't react in that same way. It doesn't have that reactivity. So usually there's some avoiding that's going along even with the people that are revisiting it, and that's why they keep on thinking about it often. And I want to go to number 2, the people that avoid thinking about it as much as possible. Just to think about that. There's a revisiting that's happening because I'm avoiding it. I'm always avoiding this thing from really, really being, thought about. That means that the person is actively needing to push things away, or push certain feelings away, or push certain thoughts away, and in that avoidance, there's things that are not being dealt with, and it's going to come out. It's coming out in a certain way with that person avoiding what they're avoiding. That's what I would say. That 1 and 2 are more connected than opposites.
Number 2, do you believe the Torah and Chazal directly address trauma and emotional healing? 46% of people say yes, 21% not really, 34% I'm not sure. So basically 55% of people don't think the Torah talks about it, while 46% of people say yeah. More people think not. What's Binyamin's take on trauma in the Torah?
It's sad that people don't get exposed to what Chazal and what the Torah have to say. Not only do they have do Chazal and Torah have what to say, it is the richest source of I think direction and of insight into healing trauma. I think, and it's not a contradiction to everything that psychology has. I think that so many of the techniques and of the wording is so needed and so effective and so important in terms of the field of psychology. But that doesn't mean that then we can't go back and find and see such an alignment with Chazal in so many different ways. And these are things, like I said when I was starting, we're people that have lived through trauma, and not just lived, have survived and thrived. So to say that we have nothing to say about it is preposterous. It cannot be. And so what do we have to say? I think that if we look and we know we have to have the right eyes and an open heart, but to look at, I want to give a few examples, and I think that it'll bring it out. That one of the halachas we have is to be an oine, right? That lo aleinu, if someone loses one of the close relatives, the time between the loss and the kfura, the person doesn't do any of the mitzvahs. And so the simple thing is that the person's busy with the mitzvah of kfura. But there's, if you look, Soloveitchik and Halachic Man brings down, he quotes, it's a Taisvis really. He says, no, that's not the pshat. That the Torah understood that when a person experiences a loss, they should and need to be in such a bewildered emotional space that it's not the time, and they don't even have the capability right now to be doing active mitzvahs. So so the Chazal is saying is that we respect and want a person to get into the place where they need to be at that point in their life. That's an example. What Nichem Avelim is. What if you think about how Chazal understood grieving, and there's so much in there that is really remarkable. I'll tell you something also. This is like a little bit more of a modern example, but I found it very interesting. There's a big controversy. I'm not getting into the controversy. You could hold either way. It doesn't matter. There was, should the Holocaust have a separate day to be remembered, right? So people have Yom HaShoah, or should it be included in Tisha B'Av, right? This is a thing, and there's a famous letter from Rav Hutner, where he was very much supporting that it shouldn't be a separate day. It should be included. And again, not what you do or don't follow. Everyone should do whatever they think, or whatever their leaders or Abbayim tell them to. Rav Hutner's point was, he said, we want to understand tragedies, not isolated. And it was this first point that I was saying today. We want to look at it in this context. You can't separate one thing that happens to our people, even if it's as enormous as a Holocaust. Rav Hutner was saying, see it in this greater context of the day that we just went through last week of Tisha B'Av, because that's the way a person has to see trauma. Trauma is part of a continuum, especially collectively as a Jewish people. So it fits into from the Meraglim all the way to whatever, October 7th, and everything in between. And that's what we go through. It does something to put it into a larger vision of where we're starting from, but where we're heading to. And I'm just giving you again a couple of examples, but to be able to, and I was alluding to things before, of, I think if you read the entire, you go through the Seder, Pesach night, you got the mitzvah Sipur. We have to talk about everything we went through, and maschel beganus. You can't just talk and go back and to go over, and the power of speaking things out. It's how we deal with trauma, but we just have to have the eyes to see it over and over again. So many different places where Chazal was and the Torah was so attuned to what we now know. The psychodrama, we're reenacting traumas that we've gone through. The Seder, we don't just, so much of Yiddishkeit, we don't just talk about things and learn about it, right? We go and we bake the matzahs, and some people put it on their back, and we eat it, and we lean, and we're doing actions to really relive both Golus and Geula. We could give a whole share just on the Torah's approach to these things, but I think that a couple of these examples can suffice to show how Chazal talk about trauma and emotional healing.
Okay, let's go to the last poll. When you think of healing from trauma, what do you believe is the most important? A, processing the past. B, learning coping tools for the present. or C, rebuilding hope for the future? So 29% of the people said processing the past. 36% basically learning to cope with tools for the present or rebuilding hope for the future. It's basically both looking forward. What's your take on that, Rabbi Yemen?
Yeah. And in school they used to have also choice D. And then they would have all of the above, and then there would be E would be none of the above, right?
Anytime I do all the above, everybody chooses all the above.
I know. No, it's good. You
But they're all good. They're all the right answer.
Yeah, they're all the right answer. They're all the right answer here. But, it's nice. I know that there are extreme camps. There really are. There are people that. And I think it depends on the different points in life. There are different people also, different approaches. There are points in life, you go through something. The main thing that many people need is like right now I need to just rebuild. I need to pick up the pieces and move forward. Right? It's not the time sometimes to look back and to process too much and to be able to put your feet back on the ground and to move forward. And then the right time, a person, when he's a little bit stronger or she's a little bit stronger in a more solid place, can then go back and look and process. Like that story, there's, I have to remember exactly where it is. I think it's from the Beis Yaakov or from Beis Yaakov and Ishbitz. He talks about the two names of Yosef Atzadik's children. Right? Yosef was someone who went through a lot of trauma. What are the two names? Menachem and Ephraim. And the two names are Nashani. Like the first thing a person sometimes has to do is to forget. You have to just like avoid the past and start. And then much later on, when you're in a different place, Ephraim, you're able to go back and process. And from there, from a solid place, when you process, then there's a growth that's able to happen, much greater than if you would have avoided the past, or if you would have gone to it too early, and you would have probably been buried with some of the overwhelming feelings. So I think that there's a place for both, but we have to be able to get back at the right time to looking at things when we're in a more solid place.
Okay. Okay, let's get into it tonight. Anybody wants to ask a question, please text me. We'll go to the first live question, okay? Hi, how are you?
Fine. Thank you. Thank you very much. Okay, here's the question. When you said over that story of Eli Wiesel, that the Rebbe asked him, what would you like to cry? So that really struck a chord by me. What strategies can you give somebody who is not really in touch with his feelings and can't really cry over the past? And what's blocking it? And what could we do to try to break through this barrier, just to feel the feelings that sound so enticing, or I don't know the right word, to cry. How do we get to that?
Yeah. You reminded me. I don't know if anyone ever watched this of The Wizard of Oz. So right, that they all wanted different things. So right, I forgot the one of them wanted a heart. Right, to be able to we crave that, to be able to. It's an excellent question. How do we, if we've been disconnected, and so the first thing is also to understand, without going into each specific story, often we don't feel, because we have to respect it, that we needed to disconnect, because had we felt during our childhood or during the difficult things that we were going through, we didn't have the tools, we didn't have the kalim for it. So as a survival, we needed to distance ourselves, to harden ourselves, that we shouldn't fall apart.
Right.
But now it's many years later, or whatever it is, and now we're adults, and now we want to, and we need to feel. How do we do that? So there's many different ways, and say in therapy we work with this very, very often. One of the things is, from a somatic approach, let's start with that. Emotions themselves are sensations in a person's body. So, for example, if I'm scared, what's the sensation in my body? So let's say my heart will go very fast, my hands will sweat, my stomach might feel tight.
Yeah.
Emotions show up in my body. If I'm feeling very sad, I maybe can locate it in my eyes. My eyes might feel a certain tension, or I might feel a pit in my stomach. If I'm feeling shame, basic places I might feel on my cheeks, a certain sensation. So these are things that we often overlook. What we try to do is we try to slow a person down, where we're going back to different things and we're asking a person to tune in and be present in their body. That's a place to start, where a person starts to reconnecting. Very often we're in our heads, and the head, if you're just in the head space, disconnected from the body, doesn't feel it. They say the longest journey is from the head to the heart.
Right.
And so it's reconnecting, being aware and present. So often with therapists, if you, for example, do like a somatic intervention type of work, they'll try to track where the sensation is when you're going back to different stories in the body. And then when you're able to do that, you're more grounded, you're more connecting to sensations. Other approaches are when we do some psychodrama work, those that do like more experiential work, when you leave the head and you enter back into certain roles. So sometimes it can be playing yourself as a child going through a difficult situation, or it's sometimes reenacting an experience that you went through. So that itself, with the different shifting of chairs and getting into that role, sometimes for people, it gets past these defenses of being in the head, and they're in a very young, fragile place. And then from that type of place, they're able to access things. Now, of late, tell you that some of the most cutting edge work, specifically to heart-opening work, is they're doing a lot of trauma work with MDMA, assisted psychotherapy. That's one of the medicines that are out there that is very heart-opening, and it's able to then have people who can't go back with feelings have this heart-opening experience while they're able to remember for the first time and connect it with feelings.
What is MDMA? Is that a drug?
That's a medicine. Yeah. So they're still in the phase 3, the trial period. That you still have to legally you have to be in a research study to get it. They always say they're on the edge. They're on the edge of legalizing it, in specific places. But we do that with ketamine is the more legal route to do that work with, and sometimes that's able to open up for a person. I've many sessions with clients of mine who couldn't access feelings, and then this is able to get through the guard that blocks the person. So these are some suggestions that come to mind. Okay.
Thank you very much. Appreciate that.
You're very welcome, sir.
Okay, geweldig. Go to the next question. Hi, how are you?
Hi. Okay, so first of all, why is it so hard to find a good support, like a good therapist to work with? It's really difficult. Like it took, like you said, it took a while to get to this level of being ready to open, and then you're ready to open, and then you're hit brick wall after brick wall after brick wall. That's one question. And also, is it a bad idea for a female to work with a male? A lot of the issues come from, let's say, background dealing with the male kind of control or abuse or whatever going on. And there's a feeling of like, if you go back with a healthy male who can show healthy boundaries or show healthy, personality, like maybe there could be much more healing than a nice, sweet female who females are always sweet and nice. Like, so that was just my question.
Okay. So you have two questions. Your first question is, why is it so hard to find a good therapist? So I can't answer. I think every person's journey in that area is different. I think that I guess you had the experience where it's taken you or it took you a while. I guess a lot of different trial and error till you found someone. Or are you still looking to find someone?
No, I'm still looking. Okay.
Still looking?
I do work all day, so I need the nights and the weekends, but
Yeah,
Like
yeah.
to be at this point, to be willing is big.
Yeah.
So I'm sitting willing, I'm able, I can
Yeah.
open up, but then it's really hard when like you talk about it, I know what I want. So I'm able to open up, but then if I'm not getting the feedback or I'm not getting the work that I want, why am I paying $250 on just
Yeah.
someone to
Yeah. So listen. Yeah. So you bring up a good point, which is, listen, therapy, first and foremost, is a shidduch, meaning that the not that you're going to necessarily people who are not good or not good enough. I think that it's finding the right match for you, that really gets you, and you have and their modality speaks to you, and their personality speaks to you. So there's and sometimes there's trial and error. I wouldn't, if in the first session or two you don't feel that this person is going to help you, then it's to go on to the next. And I encourage you to keep at it, and you'll find that person.
You really
I
think
very much
so?
hope. I mean, I hope. And
In every session, when you become vulnerable and open up, and
yeah.
your lips so raw, it's like
Yeah.
easier just not do it.
Yeah, sure, 100%. Listen, real therapy, it's hard work. it's
No, the
opening
work
up, and
the work is I can do. There's a willingness. It's more the
yeah. So you have to
feeling that
try
you're
that.
carrying the therapist, or the fact that you're so good at what you do that it's a flip. Like, no, the ability, like with trauma, like you want to be able to have a tantrum and someone could say it's okay.
Sure.
You know, oh, you should do
So
exercise. No, I don't want to do exercise. I want to scream and yell and have a deal, I know how to
Right.
cope. I know the coping. I know how to be healthy. I know how to be, I know all the coping. And now when you go to therapy and you're spending that money, you want to be vulnerable. You want to be totally not healthy, right? You want to be totally
Yeah.
trauma and be safe in that trauma.
Yeah. So you need a therapist who can hold that, who can go there and be there with you in that type of place. And not all clients need that. Not everyone needs that. I'm hearing that you are ready for that and you need that. So to be able to try to do some research, I think there's different organizations that can help, and even speaking to Rabbanim with different people, teachers, maybe people who know therapists, to try to really network that. Who can, at this point, if I'm understanding correctly, like who can go and be with me in a very, very raw, vulnerable, deep, open place with my traumas, and try to ask that there should be someone who I know very many wonderful, talented, and skilled therapists who can definitely go to that place with you. Okay.
So then going back to the second question, is it,
Yeah.
should I, as a female, do you go to only female, or like a
you're asking a very loaded question. So you're asking it to me. So there's different opinions, but I'll I'm being asked. I'll give you my take on it. Yeah, it's listen, I think that they say that if done well and right and appropriate and professionally and with all good boundaries, of course that goes without saying. There's a place in a person's healing, especially if there's complicated things that happened, not just with one's own gender, but with the other gender. There's a place in many people's healings that need to have at one point a therapist who is a female, and then maybe at a different stage or a different place or a different part or a time in their work have a male, and there's different dynamics that are brought out from each. Now there are people that don't feel comfortable with that, because it's deeper work and that fully understood and fully accepted for those that don't feel comfortable, and they'll get their healing. It's Hashem, they'll get it from the place that they're going to. 100% they will. And there are people that come from different sections in Kleisel and more open to that, and there's a place for that. There's a place that each of the different genders are going to bring out a different dynamic, exactly what you're saying, and a lot of the transference, counter transference, the feelings that are going to come up by working with a different gender and working with the same gender are going to both be essential parts of a person's work. Okay, so if a person feels
I'm not
comfortable,
crazy for like feeling that there might be some healing in an opposite gender.
no,
Like
not
as
at
someone who,
all.
right, and
Not at
someone who's been in trauma, like even to put it on the client that you have to be careful, then that's not therapy. Therapy is that I'm in quotes broken and I'm here, you're here to help me. So as a therapist, you're the one that needs the boundaries. You're the one that needs to be strong, not me to be strong. You just have to have like, I don't know, this was my take. You need to have the confidence. You need to own it. Let me be vulnerable and mess up so you can teach me skills. I'm coming without skills. That's why I'm here. Right. So I'm not crazy.
Right.
Okay.
No, I think that your point is very valid, and if you're feeling that, and it's again someone who's appropriate, and that feels okay, or you get guidance that that's okay, then by all means that can be a very, very important part of your work. Okay.
Binyamin, I just want to the first question. I find there are many people that they're looking for therapists, and for some reason they're not finding it. Is it possible that many times the healing they need can be just the concept of trust, which they haven't had a healthy understanding of trusting others, and therapy is being vulnerable, and you're finding yourself in a place where you're not sure you can trust that person. So then to open up, be vulnerable, and you don't feel safe because you don't really trust. So you think, let me find a different therapist. Really, what you have to work on is, discuss with your therapist that it's too hard for me, where I don't feel trust.
Yeah. You're bringing up that. I think that you're bringing up. See, our stuff gets brought into very often all the time gets brought into the relationship that we have with the therapist, and it could be that some of the issues that I'm finding with this therapist is issues that I have. I have issues with the trauma. Is always you're gonna have issues with trust and with vulnerability, because we were not safe, and we were often made to feel very vulnerable in a compromised way. So therefore, we're going to come to therapy not trusting, and rightfully so. And therefore, if we're going to not realize that and just think that it's about the competency of this therapist, then we're going to go from therapist to therapist, and we're never going to it's never going to be really gone into. So of course you're right that if this is what's going on, then that's a deep part of the work. See, part of the trauma work is, and there are people that really focus a lot on this, but it's a powerful part of the work. It's the relationship that the therapist and the client are going to have in and of themselves, and that's like a lot of the interpersonal psychodynamic work. The feelings that are going to come up in that relationship are going to all be playing out the traumas and the lack of trust and the idealizations and all these different things. And therefore, good therapy is gonna also include examining in a healthy way that, and they'll look at it together. And in this way, they'll say it's not personal. It's just to be able to give you tremendous insight into how you are bringing your trauma into this relationship and into all relationships of life. So I think that you're alluding to that. Now, so it could be that there's that element, but even if there is trust, it could be that there are certain therapists that their thing is not to necessarily go into these raw, vulnerable places. Certain therapists like to do more skills-based work and more coping mechanisms, and that's their work, and therefore and people need to to go to a deeper place. And sometimes it's the therapist who that's not his or her forte or not his or her approach. So if the people that need and want that, then they're going to have to go to places that are that go there with them. That literally, I recently I heard someone was talking, and he said over such a beautiful thing. He said, that it says Toiv Sheberoifim Legehenim. It's a very powerful thing. Like the best doctors are gonna. So he said a beautiful thing. He said, no, what Chazal is saying is Toiv Sheberoifim. If you want to be a really, really good roifer, a really good healer, Legehenim, you have to join the people who you're sitting with when they're in a very, very dark, broken place. Legehenim, Toiv Sheberoifim Legehenim. You go right there to the depths with them, and you sit with them, and you're able to feel with them and hold them in that type of place. That's what it means.
Wow. So hopefully a good therapist can communicate, put it on the table in the beginning so that they don't have to feel after being vulnerable and it's not working. So here's a question, very general, but I've been through some very painful experiences and I'm torn. Part of me feels I should go back, think about them, work them through, but another part just wants to move on and forget. Which is actually healthier, facing the past or letting it go?
Yeah. So this is really going to the heart of what tonight's talk is about, and the answer is that it's a timing question. It's not one or the other. If a person really wants to be in a full, authentic life, energy of being themselves, of being close to the people around them, then on one hand, we move forward and we put together our lives and we stay busy and productive and we try to accomplish. And we need to, at the right time, with the right support, with the right modalities, with the right help. There's many different ways of doing this. There's not one way. There's many different ways of even doing this outside of therapy. Not everyone can, and that's not always healthy too. But some people can. To be able to go back and to be able to revisit and feel and really work through the things that we've been through. I'll give you an example. I had someone recently was talking to me, very, she's a newly married woman who has a couple of young kids, and very, very upbeat, positive woman. And when she grew up at a young age, she lost a parent. She lost a father when she was young, and her mother was very upbeat, and as a kid, tremendous amount of positivity and resilience. And listen what happened. She said she never went back to that time in her life. And she says she has a daughter. Her oldest is maybe 6, 7, 8. And there's one thing that she literally explodes at her daughter. What is it? Her daughter is a regular kid who likes things that 6, 7, 8-year-old girls like, and she's into this, and she complains about that, and she why. And when her daughter complains, and when her daughter has any laziness or any negativity, it makes her blood boil. And she just goes like, why aren't you grateful, and why aren't you a positive girl, and why aren't you? And it's starting to hit her that she's never gone back and been able to feel really what she needed to feel as a girl. She needed to be a positive, upbeat, low maintenance child, because she was her mother was a single mom raising her and a bunch of siblings, and so the negativity of her daughter, which is again very normal, is something that is now the trigger to her and is getting her to then go back. And once she goes back and she's able to then feel what she couldn't feel as a child, the reactivity of her daughter will not be the same. It won't. You see, trauma comes back if we didn't process something in very, very strange and unexpected ways. We have to be able to integrate our full life story, again, at the right time, with the right help. But without that, we're going to be either overreactive to different things in our life or underreactive to different things. It's not going to be calibrated. It's not going to be that we're present and that we're able to feel and let other people feel their feelings in the different areas of life. So we want to have the ability to look back at the different parts of our life, having felt it, and not obsessing about it, but not ignoring it.
Marty de Binyamin, let's go to the next live question. Hi.
Hello. Hi, can you
Yes.
hear me?
Sure.
Hi. So my question is, from my understanding and knowledge, there's evidence in, modern psychology that says that kind of going back into the trauma and reliving it isn't effective. So can you explain or like prove like how going back into it is effective? Because my understanding is that when a person goes back into it, it sort of like re-traumatizes them and makes things worse. So can you just kind of like explain, since you've been answering questions very practically, so I'd really like to know like how
Yeah.
it works, like how it
Yeah.
helps a person process.
Yeah. Okay. Thank you. Thank you for your important and wonderful question. So in terms of, let's say, the research-based approaches to trauma healing, these are all studies that have been done. I'm going to tell you different modalities: EMDR, somatic experiencing, trauma-focused CBT, IFS, and brain spotting, and many other modalities. Now, all of them are sensitive to your point, which is, how do we go back to the experiences that the person went through that were difficult without re-traumatizing them? So all of them are dealing with your question. And again, there's safety protocols, there's creating first, grounding abilities that the person needs to have, safe places, a trust with the therapist that they're working with. And pretty much the common approach to almost all of these different, again, modalities, I don't want to go through all of them, is that we go back to the difficult situation in very, very small, bite-sized sizes or visits. We don't go back and flood a person with something very difficult, but we're
But
able
isn't that
to.
also a modality, like flooding? I mean, I'm also like a LMSW, so I kind of know a little bit about these.
Flooding. You're talking about something. You're talking about that when we talk about exposure therapies in terms of anxiety or phobias. So there's different approaches. There's systematic desensitization, and then there's flooding. But in terms of, I'm not talking that's you're talking about phobias. You're talking about anxiety. Put that aside. That's
Okay.
where flooding comes up. When we talk about trauma work and all the different modalities I was talking about, flooding is not the approach. No, it's that we go back in a very, very small, calibrated way, and we touch, and then we come back, we pendulate back to the here and the now, to the skills, to the safety that's here, and then we go back, and then there has to be, the word is, there has to be a very, very strong container. That's, if the stronger the container, then the more trauma work the more work you can do. Yeah, we have to hold it. We have to hold it. So
right. Can I just interject for a second? Sorry.
Yeah.
How does
yeah,
a person like form that strong container? Like if they're, I feel like it's almost like I don't know. It's like a catch-22. Like if a person is traumatized, then how are they supposed to like form that strong container in order to heal the trauma? You know what I mean?
Yeah, excellent. So let me explain. So the container has many different parts to it. So for example, let's say you're coming to a therapist. So one of the parts of the container is the relationship. There's a person who you're sitting with who is a safe, trusted individual in your life. You emotionally experience a safe feeling in your gut when you're with that person. So that's part of the container. The space that you're in becomes a safe place that you're in. The time of the week. There's a lot of different things that are part of that container that make it something very, very safe for a person. So even when you're in your body, so sometimes I'm afraid to feel. If a person went through trauma, they're afraid to go back to certain feelings. So we want to make their body itself a safe container for feelings. So how do we do that? If a person's frightened of all sensations, we have to first give the skills for a person to be able to just be comfortable in their own body, to relax themselves, to either envision places that relax them. Sometimes we'll use music, sometimes we'll use scent. We can use many different sensory things, modalities that ground the person, that allow a person to also, that's also part of the container. So there's the office that you're in, the person you're sitting with, your own body becomes a safe container, right? And there's a lot more to this. So these are all part of that. Then in that type of setting, in that type of context, a person can, and that takes a long time for some people to even get to. That's why the timing is so important. Then a person can revisit, lighter and to then more heavier parts of what they went through. Okay.
So it sounds like it's more like the therapeutic relationship and the environment that's a safe container as opposed to the person themselves.
Well, no, but one of the things is the person themselves, because if I, for example, am going to be afraid of feeling things in my own body, right? So that's part of a person themselves, then I don't have the container to go back to a story, because then my heart's going to beat and then I'm frightened of the feeling and then I start to panic. And no, so I have to first be able to learn my own grounding skills, to be a present person, to be mindful, to be comfortable in my own body, to be able to then in myself go from agitation or from feelings to then back to my own calmness in my body. So that's those are skills within a person. Okay. That's part of it. Yeah.
What about the research though? Is that like fake? Like, is it because it's always changing and it's not really?
I'm not sure. When you say, I just quoted you, the top 6 or 7 approaches to trauma healing that are all research supported, and that all, none of them flood a person, but they all have parts that go back to the trauma in a healthy way. So EMDR has its protocol, they all have the different protocol, but when they're done responsibly and they're done with in a wise way, then it works. But just you're saying to go back to the past, that's not, to go back without any of the things we were talking about, and without any of the protocols of these different approaches, then it could be damaging. But these the approaches that we were talking about all take into account establishing safety and that strong container before any of that work is done. And then the research is very, very much supportive. And in that context, if we go back, then it's a tremendously effective healing tool. Okay, so it depends on, I think, how it's done.
Got it. Okay, thank you. Appreciate it.
Okay, you're welcome.
Let's go to the next live question. You're on.
Yeah, hi. I wanted to kind of piggyback on a question that was asked earlier. Somebody asked about, when there's a long period of time where a person's not connected to their emotions, they're, they've turned, closed the door on their emotions, and they're, the question I believe was how to get back in touch, and like he was talking about crying and things like that. So, you know, I guess piggybacking on that, I'm asking, what happens when you're dealing with somebody that is like like very high level functioning, but like on the spectrum in the sense that, and one of the areas where they struggle is identifying with and connecting with their emotions. And when they try to do any of these modalities that kind of connect them to emotions, it's extremely distressing and it's very difficult.
Yeah, yeah, yeah. That adds an entire other dimension to this work, and there are people that their specialty is working with giving people on the spectrum the skills to try in a non-distressing way to identify and to be in touch with emotion and with feelings, and there's many different simple direct ways to try to allow people to, even on the spectrum, to get in touch with different emotions. But you're 100% right. It's going to be it's a much more of a challenge. Then we're not talking. It's a little bit of a different discussion, and I don't want to get too into that, because I want to keep it that the disconnect from emotions is really coming from a trauma-based response. That's really what tonight's talk is much more about. You're right.
Right.
There's
Right.
other things that can come in here and make it and add complexity to cases. But in
Correct.
terms
So
of
what I'm saying is, if
yeah,
there's a trauma, if there is a trauma
yeah,
response, and that actually was kind of maybe possibly hiding the spectrum, aspects
yeah,
for a long time, it was seen as a trauma response. So, and there is actually both, so
yeah,
so
yeah,
so then
yeah,
what
yeah, yeah.
happens?
So then I think that the order of things is probably going to be to give a person the best skills that they can have just in general to start identifying with their emotions. There are people that specialize in working with people on the spectrum and helping them. And then from there, once there's an ability to identify as best as that person can the feelings that are going on, then from that type of place to then go back to parts of their life with the ability to have some feelings and to go to that. Okay. But
Okay, thank
it's
you.
a difficult question, and thank you for asking. Yeah.
Thank you.
Okay, let's go to the next live question. Yum, there's so many questions there. I'm loving it.
Okay.
Hi, how are you?
Oh, hi. Okay, you
Yes.
hear me?
Yes.
Okay, hi. I'm a IFS therapist, and I'm also certified in EMDR. So it's when I first did EMDR, I was getting very successful outcomes, and people were actually reliving their trauma and getting better through going. In other words, going through the fire, you get over the fire. So originally, when I did EMDR, that was my conception, that you have to go through the fire to get better. And actually recently, when I learned with Janina Fisher, she said something very interesting. You don't have to necessarily go through the fire again. You just have to give the inner child what they were missing in that situation. Sometimes it's counter indicated to go to the trauma. Actually, sometimes that is re-traumatizing. Even as a trauma therapist, you just need to have enough, give the person enough, as you said, safety to hold enough emotion to meet the child in that scene or in that trauma and give them what they should have been given, the validation, the security, the safety, whatever they needed then. They don't have to actually stay in that horrible scene. And even in an IFS, very often they start experiencing the trauma, and then they'll say, oh, I want to get out of here. So the adult part of them takes the child part out of that terrible scene and give them what they should have received. So really, it's not about necessarily having to relive the whole scene. It's just about being able to hold enough emotion to experience certain vulnerable feelings
Yeah.
just enough to comfort that part of yourself. So I just wanted to
Yes.
add that to the person who
Yeah.
was saying that's
Thank you.
what the research, I think, was, that's what she was maybe referring to possibly.
Yeah. Thank you so much for pointing that out and for bringing that to light. Is it because let me I restate it, and I hope I'm getting the point that you made accurately. See, we didn't clarify what does it mean to when we say to fully, feel the difficult things of life. Do I have to write a memoir or an autobiography or a descriptive step-by-step of exactly the parts of things that I lived through or went through? 100% not. That's not needed. What we mean by going back, so you were talking about the inner child, getting the things that he or she needs. What the premise of that is that I'm aware of what I need, meaning to say, I needed attention, meaning what? I feel invisible. And when now I'm able to feel that someone is giving me some listening ear and I have a voice, so that is going back to that void that I lived through and felt over those years. So I don't have to go through every story that I went through of being invisible, but I can go back. When the guard is down, the healing is amazing that the brain goes to. Let me give you an example. Right, if a person has a cut on their body, right, what do we do to heal it? We do very little. All we have to do is we clean the area, and we let healing take place. There's something innate in our physical body, right? That's able to heal. We're created to heal from traumas, but we have to create the right setting. And what so often happens is that we don't have the setting. We're right away told, we went through something difficult. Oh, it was nothing. You're much better now. Okay, let's move forward and move on. And the area was never able to mend. Now, what do we need to actually give it the setting and the healing that it needs? So sometimes it's going back to a certain sensation, a small part of it that wasn't allowed to be felt, wasn't allowed to be addressed. And I'm able to then go back and I can get in touch with what that child, let's say if we do inner child type of work or IFS, every modality has different words for it, different exiles or different things that are part of my dark ghosts of the past. And I'm able to touch an edge of it and feel it, and then heal from that. Get to a place where I now feel, let's say, in a relationship with the therapist, or even in my own breakthrough, like this is not my fault, or I'm able to let go of different guilts or shames. Then that's able to cascade to a big healing that doesn't need to then go through the depths of the nitty-gritty of full stories or of all the many stories that a person went through. So yes, but each person is different. Each story is different. What a person feels they need to go through. You see, it's when the guard is down, a person will go to where they need to go. Like we have that all the time in ketamine sessions. We never know where it's going to go, and the person will go back to a small part of a certain story, and they'll look at it in a different way, and that's their breakthrough. I had someone recently, we were doing a ketamine session, and went through a tremendous amount of trauma, a very, very, very critical father. And in this session, we never know where it's going to go. He suddenly starts to cry, and he starts to feel tremendous sympathy and empathy for his father. And his breakthrough is that he starts to see that his father himself was orphaned and never had his own upbringing. And he started to see that everything you ever told me was because you didn't know what it you didn't have your own father. And it took away all of the personalized feelings of inadequacy that he had. So what was this guy's breakthrough? He went back to being a child and that critical father, but the breakthrough was going back to a generation earlier, to not even to his own story, to what his father went through. And then now he's just light and free, because all the criticism of his father, that he had such resentment, it just opened up. So where we need to go and what we need to go back to is TBD, to be determined. Each person is different, and we go back to not necessarily what we'd expect to go back to, and what we go back to where we need to go. If we're, again, not in a very guarded, rigid way, we talk, and in that we're led to hopefully where we need to go, to the sensations, to the feelings, sometimes to the stories, sometimes to the stories behind the stories, and we're able to then have openings.
Binyamin, let's go to this question. I sometimes think about our parents and grandparents. They went through wars, losses, much harder than we can imagine. Did they actually process and deal with the trauma, or did they just suffer silently? And if they did heal in some way, how did they go about it?
Mm. You reminded me. There was it's an old book. One of Swilly Besser wrote a book in it's called "Warmed by Their Fire." I think that was the name of the book, 15 years ago. And one of the stories, I think, was was about his own grandfather. I think it was visiting the Imre Emes, and he was saying hello. He was a young boy, he survived the war, and he went one Friday night. I think he had come from Charkiv Hasidim, if I remember correctly. And the Rebbe called him in for after the Tish, I think it was a long time ago. I read the story, so to have tea only with him and this boy. And they drank tea, and they were talking about his grandfather. And then I got up to leave. This little boy said, this was Sully Best was writing, I think, about his grandfather, if I remember correctly. And the Mimir said, if you don't mind, if you can just sit for another minute. He said, sure. And suddenly the Imam, I think he lost a tremendous amount in the war. He suddenly broke down crying, and he started banging on his chair, and he said, I have no one to cry with. And finally, you're someone who went through what I went through, and we can cry together. We can cry together. And he started crying. He said, I'll never forget how the Rebbe opened up. He couldn't do that with his Hasidim, but he found some boy who he felt that he would understand, and they would understand each other. You asked, there's a lot to say. I come from, like many of you, maybe the parents, grandparents, all survivors, and there was a tzara de Rabin. I want to say, first of all, that they all went through what they went through together, and everyone who was in my grandfather's shul, I think there were 98% of them survived together, and had a language with each other, and so it doesn't mean that they sat in a therapist's chair and a couch and did one of these modalities. It's not just about that. They had so first of all, many, if not most, maybe all, lived their many years of their life, or maybe all the years of their life, haunted, and with nightmares, and with I had a grandmother. She lived Arichas Yom, just passed away. Actually, it was a yahrzeit Shabbos. She passed away a year ago, and she visiting her till the very end, and especially when her memory wasn't so clear. What many of you may have had parents and grandparents. She constantly going back to those years and to some of the darkest places that she lived through and went through. So when you ask, the previous generations what they lived through, they lived through and sometimes never got out of it on one level, and on the other hand, they had different ways of getting support. Sometimes it was from one another. Sometimes it was from leaders who went through what they went through, and they would go and sit by them and learn from them and learn with them and cry with them. And so there's no one answer. So I think it's a little bit of everything that answers that.
Marduk. Okay, let's go to the next live question. Hi, how are you?
Hi. Hi, can you hear me?
Loud and
Yep.
clear.
So I wanted to ask like this. I'm just getting into trauma therapy a little bit, realizing more and more how, the necessity of it. It's starting to seem like to me how like that almost everyone out there is traumatized. Like, is there anyone healthy? What does this trauma mean? Like, when we talk about this trauma, it's like this big ball, this big thing. I know it's like a kind of like a loaded question, sort of, but I'm trying to make it smaller.
Yeah, you're bringing up, I think, an important point. Like, is everyone traumatized? Does everyone need trauma therapy? Spend your whole life in a therapist's office or many years, and as I think we need to address this point and hopefully in a clear way and in a healthy way. Do we all go through difficult things in our lives that are not perfect? Yes, that's part of being a human being. Yeah, right. We could have had the most well-meaning fathers, mothers, and if you're zeicha to be a father or mother, right, you're trying your best. But it doesn't matter. If you have one child, if you have even more than one child, especially, right? When you're looking at that one child, you're not looking at the other one, and you get tired and you get stressed, and you have to take care of yourself, and with trying our best and with our parents trying their best, are things imperfect? Yes. I mean, we're talking about even one part of trauma, and then there's part of life is, right? People don't live forever, and there are people that are close to us that we could have lost, and there are people that many other forms of trauma. There are people that are unhealthy or take advantage of other family members or of children. There are people in leadership positions that do that, or are manipulative. There's emotional, and there's verbal, and there's physical, and there's sexual, all sorts of traumas and abuses, right? All these things, and so many different variations of all these different things. So we all of us live through things that are difficult. Some people had difficulty with friends or were bullied. Some people had difficulty with school and education, and that was traumatizing to them. That they came home and they were always the one who was, special needs or special education or added support, or just were in the right? Endless. So there's no human being that didn't go through and doesn't go through. There's struggles and challenges and hardships of and the beauty of life and of childhood. So, and in our generation, one of the tools for that, we're more in touch. Well, for whatever reason, that's the hashgacha practice of this generation, is that we I don't know, the heart is coming back very strong, and it's hopefully getting us ready for Mashiach. But there's a lot of healing that's going on, and there's many ways of healing. And so I think that to say there's only one approach is is not correct. One of the ways, and for many people is needed or is beneficial, is going to be in therapy. But in going and working through things many different ways, and many different methods of doing this. And so so first of all, your question had on it, is the view of people that we're all sick. I think no, the view is not that we're just because we want to get back in touch with the story of our life, and there's many different ways. We'll give other examples of how to. If I'm doing it with a therapist, if I'm doing it other ways. So then I don't think that the way to see it and the way to see ourselves or the way to see each other is that everyone's just traumatized and sick. No, I think that I would say we're all human beings who are trying to be human, who are trying to be fully human, our full selves. And to do that and to not be cut off and to not be disconnected, it means to be in touch. And for many of us, that means some point to be able to work with someone who can help us get in touch. It's not I think we're trying to be a healthier version of ourselves, more and more authentic and able to have closer relationships, first with ourselves, with the people around us, with Hashem. So I think that it's to look at it from hopefully from like a health perspective rather than a pathologized perspective. I think is for me is a better way to understand it and to see it. Now, I was saying that there's different many different ways. Can a person work with a small group, with a chabura, with a trusted friend? And there's a place and there's a time and there's a necessity for someone who's a professional, who's licensed, but because there's many different levels and layers of trauma. But in some of the more mild forms or regular, a person who's everything is going well but wants to get to a deeper place. There are wonderful tools that a person can use, and sometimes can get a trusted friend and to go into have deeper type of conversations and to work things through. And that would be inappropriate if someone's really dealing with this more serious trauma and the container we were talking about before. So there's many different layers and levels and many different ways a person can approach this type of work. But I think it's important to I want to go back to your question, to not see ourselves as victims that and pathologized people that are sick because we have to work through stuff. I think that's staying in a very victim type of role, and to be able to hopefully see ourselves as no, we want to get more and more in touch and healthier, to be able to process things we went through, and that's part of the healing. The way I see myself is to see myself as a person who is dealing with and has to work through some things, and you will. The one of the people who talked a lot about it wasn't even about trauma, but they ended up being written about as a fellow Karpman. He wrote the Karpman Triangle. He was actually working a lot with politics, and well, I'll explain. The Katzin triangle is, he says that there's very often there's three roles that people of society play. There are perpetrators, there are victims, and then there are rescuers. And he said, and very often in a person's life, the person will go from one role to the next role to the next role without even being conscious of it. And they're still in the trauma triangle. They're still in the Katzin triangle. And they think that there was healing that went on, but really they're stuck in trauma. Now, I'll give you an example, right? A person went through a difficult thing, was a victim of some trauma, and then they decide that they're becoming a therapist or they're becoming a Rebbe, and they're going to rescue people who are victims of trauma, right? Now, it sounds nice, but be very, very weary of rescuers. right? And I hope that you get why, right? Because this person is still in trauma mode. He's just not a victim so much. He flipped it. Now he's going to rescue people. And what does it mean to rescue people? It means that he's going to be on the lookout for victims. He's not going to. He's going to try to, at 2 a.m, be there to rescue them, and to that they're going to be dependent on him in the unhealthy way. And then listen, what's going to happen. So he went from a victim to the rescuer, and then what's going to happen is this guy is going to one day be like, listen, I thank you for your help, but like it's a little too claustrophobic, or he's not going to thank him enough. He's going to break off. And then the rescuer is going to get very broken. He's going to be a victim again. This guy doesn't appreciate me too much, or he's going to be a perpetrator. He's going to then start to tell the victim how he is not appreciative. So you understand, this guy, this victim, is a rescuer, he's a perpetrator because he's still a victim. To get out of trauma means you're not a victim anymore. You're not a rescuer. You're not a perpetrator. It's being able to emerge into it, that it's not a binary or a tripod of existence, that the world is not broken. The most traumatized people, if you look in society right now, right? So often you're either you stand with me, or you're a perpetrator. If you look at society, it's a traumatized individual that creates either you're a victim or you're a perpetrator. Meaning either you're a rescuer, you join us as victims, or you're one of the bad guys. These are traumatized people that divide the world into these 2 or 3 different categories. So one of the things is, in our trauma work, it's to stop seeing ourselves. Hopefully we emerge from being a victim. Being a victim means that I have no autonomy, that I can't see myself as capable. So part of my healing is going to be that I'm not a victim anymore, that I was in that place because where I was taken advantage of, from who or what happened to me, or the loss was overwhelming. But with emerging from that and going back to that, I feel like, but I have now the ability to feel it, and to move on, and to grow from it, and to learn from it, and that I can make choices now, and that I have new capabilities. So I'm not a victim anymore. And then I might even have something to offer people, but I'm not going to be a rescuer for people. I'm going to honor other people. I don't see other people as victims. I see other people as they have latent abilities that I'm going to maybe help if they're interested in uncovering it. So I don't see them as victims. I don't have to be a rescuer, right? So that I don't become a perpetrator, right? I don't have to divide the world into these extremes. So it becomes a healthier dynamic. So I have a long-winded response, but I'm just going back to your comment of seeing the self as, are all people sick? And the answer is no. I think that to try not to need to see the world in that type of way, that they're the experts of the therapists, the rescuers that are going to come heal the sick people of the world. No, to not see it in that way. There are supports. There are people that are going to support and help uncover a healing that exists within the people that are in the need of that, and then they'll come to be able to stand on their own feet after they uncover that, and they're helped to uncover that from people. Yeah, I have someone message. Okay.
Amazing. I just want to add,
Okay.
sometimes being healthy is being able to go and talk to someone else, not living in your own, it's like it says, not saying a healthy person has a place. It could be a rav, a friend, just a place where they can discuss. Everybody wants to grow. Everybody wants to, to look back, see why get triggered, or why this doesn't work, it does. So if you could do it yourself, okay. And then those who need the help, but many times it's the healthy people that have a place where they can talk to someone else and discuss, give me some feedback on myself. Maybe I'm not seeing it right.
Yeah.
But here's a question that came in. Yeah.
Yeah, Menachem, on your point, at some point, we need to have others. We need to have others as part of our story. Who that other is, that depends on a person, because by others we were wounded, and by others we need to heal. It's going to need to play out in some form of a relationship, a deep, authentic, vulnerable friendship, whether it's a therapist, whether it's group members, whether it's in some way, the just to be able to do it all alone within ourselves is going to be incomplete. It's going to be incomplete. There's a tremendous amount we can do. There's wonderful tools. Journaling. There's Nicole Sachs wrote a book, Mind Your Body. She talks about journal speak and about the healing, chronic pain that way and trauma that way. And it's wonderful. And this trauma journaling, all of it is effective and should be part of it. But we all know then to be able to talk to another person and to it's the right the Sipur Yetzias Mitzrayim, to be able to leave the Meitzarim, we have to be able to speak it out and to be able to have people that are in our lives, and I give us all a bracha. We should have people and that we can talk and we can open up with.
Amazing. So here's a question. My trauma feels like it has become part of my identity. Is it possible to heal without losing who I am? Or does healing mean becoming someone completely different? I know there are different versions of this question, but many times people, all they know is their story. And
Wow.
it can be scary. Who am I?
Wow. What a question. I just want to take in that question. I think it touches on so much. I think that the person is alluding to something very profound. There's so many subtle things that are part of the resistance and part of the hurdles of healing. And I think one of them, the one who the questioner is alluding to, so it's subconscious, or it's so nuanced, that a person wants to or needs to very often stay with the narrative that they are very comfortable with the schema of the way that they see themselves in the world, with that victim role that they're very, very used to living from and seeing the world and seeing themselves with. And so it's frightening. It's very, very scary to heal and to start to leave and shed that familiarity of being a victim, or of being powerless. It's very seductive. It's very, very attractive to stay in a role. And it doesn't mean all or nothing. It means in certain ways or certain places in my life, I'm powerless. And that's a very, very comfortable, familiar, cozy place, even though it comes along with so much pain or so much limitation. It's a place that it's very, very hard for a person to leave. It's very, very hard for a person to leave, and they see themselves in that type of way. And I think that part of the work is to face that, and to face the limiting view of myself, and why it's comforting, but a person, as life moves on, there's also there's another side of them. So often there's a voice that wants a person to actualize themselves and to heal and to become their full selves. And there's this, like, if you want to take an IFS approach, there's often different parts within us that then have to confront one another, and And I think that, you know, one of the thoughts that's hitting me right now is that in that person's work, you don't have to give up in order to move past. There's an ability to honor the story that you lived through and that you're living through, what you went through, and the struggles and the difficulties, and to be able to take the gifts that ultimately offered you and produced and developed within you and pulled out of you. So I'm saying it's when you talk about the identity, I think that it has to be done working with that person. That at the end of the day, we all contain all the scars that you know, all the battle scars of all the things that we lived through and that we went through on one hand, and then on the other hand, to also have transformed and have emerged and have evolved from all of that. So I think that maybe touching on your question, I think part of the answer to an individual who's struggling with this is to have it part of the story and have it part of the identity, but not a limiting part of the identity and not a limiting part of the story, but something that becomes integrated well. And that becomes a source of pride for that person, not something that's shame based. That's the same thing that could you know, you don't have to let go of that, but it can be reframed. So I think it has to happen slow, and it's scary. Any change is scary. Transformation is scary. But if we do it step by step and, you know, become more and more familiar and comfortable with it, it's going to reinforce. We're going to see, wow, I'm in this new place and I don't have to have the same shame and the same loneliness and isolation or disconnect that I needed to have in the past. I can keep that identity, but sort of take it in such a different way. You know, the beautiful line that's said about Joseph Atzadik, right? That, you know, was he sold or was he sent? Right. That's so it's the same story. So how does he want to look at his life, and how does he see his story? So if he was sold, that means he's hated and rejected. If he was sent, the same story is a mission, and it needed to happen, and he's going to see in everything that he went through significance ultimately, and there's pain, and that has to be felt, but it gets enriched with a different meaning.
Okay, wow. Just one more question, if we could, before closing. When trauma happens in a religious community, it can be hard to trust again. How do you reconnect spiritually when your faith or community was part of the wound?
These
You want to talk about it
are
next time?
heavy. No, these are. I'm breathing because these are heartbreaking questions and important questions and necessary questions. There's religious trauma. And you know, I dealt with many individuals who have different versions of this, where the people that were representing God and Torah and Yiddishkeit were the perpetrators, and sometimes it gets so ugly it's in the disguise of all of that. It's like literally, you know, using these things to do the manipulation and the perpetration. Without going into details, so you see the healing of these individuals. First of all, my heart goes out to every one of them, and I've seen the healing, and I marvel at it. The courage and the strength and the perseverance that's needed for an individual like that to not throw out you know, everything to do with Yiddishkeit because it's so intertwined with their trauma is is nothing less than heroic and miraculous. And you see that individual must untangle or detach the people that did what they did as being representatives of the Rebbeinu Shalom and of Yiddishkeit, and that's very, very hard to do, but in some way, shape, or form, that's what needs to be done. That those are the opposite of anything that God and anything that Yiddishkeit stands for. And it takes a lot for a person to be able to do that. But when one is able to know that this was coming, these people were using, you can use a fork and a knife to hurt and to cut and to kill a person. That's not you're taking something that hopefully could and should be used for something that's productive. And obviously, and these are neutral things. You could take things that are holy and things that are full of life and full of chiyus and full of healing, and you can literally use them for the most destructive things. So it's to detach that these individuals were the sickness, not the things that they were using, not the God that they were representing. And it's to hate the way that Yiddishkeit and God were used and represented, not not to kill and to demonize the things that were used and abused, in the name of religion. So that's part of that work, but it's heavy and hard and often painful and long work that those individuals that need to do that need to include in their work. Okay, so I hope that addresses that heavy and important question.
Okay, Shkoyach Binyamin, let's go to the closing now. Shkoyach Binyamin Tepfer coming on tonight. Listen, the topic of trauma is a strong one, and I think that we definitely touched upon it, and there's a lot more to discuss. And again, Shkoyach for really just touching on it. Again, if anybody's here the first time, every Sunday night at 9 p.m. we have a different shir. Next week, August 17th, we're going to have world famous speaker, if anyone knows him, Avichai Cohen, brilliant man, super deep. Menachem will post the topic. Please join us next week. It should be something amazing. Hope to see everybody. Everything will be recorded on menachemberfel.com. If anybody has any questions, please email him at coachmenachem@gmail.com. Tonight's share 240. It's also going to be on the phone lines if someone wants to call, 732-305-9011. And of course on YouTube and all the podcasts, Spotify and Apple and all of them. Thank you to all the advertising sponsors, Lakewood Scoop here in Lakewood, Ellie and Ariel, 510 Central, Chayla Kaufman from JCN. And now we're going to go to the closing part. We're going to go first to Menachem and then to Dr. Binyamin Tepfer. Coach Menachem, closing.
Shkoyach, Dr. Binyamin. Yeah, trauma is not easy, and like we say many times, we have to listen to it again. This is definitely something to hear it, the soothing voice and the way you understand, you can sit. Hopefully people were able to feel a little bit of the safety that's needed and the trust. But the one word that I want to mention what you said is to honor wherever you are. For some people it's too hard, they're not ready, or they started and they're confused. Many people are on the other side, or some people are lost trying to figure themselves out. So there is that part, just to honor that part of this is where you are, this is how you feel, and that's okay. You're not always need to run away. It's just to be able to be there. Not always easy. So my bracha is to all of us, and me included, we should be able to grow. And if there's anything to heal, whether it's healing or growing, we should have that space. The people we need, we can find that shidduch, whether it's the therapist or somebody that you can talk to, so that we can continue the work, continue on our journey, and to grow so that we can become closer to the people that we're close to. So shkoyach. Thank you very much.
Thank you, Binyamin.
Yeah.
You got 2 hours.
Yeah.
Give us your closing.
This was it's just an honor to be part and to hear the really, I think, amazing and on point questions that brought out tonight's topic. So I appreciate very, very much being part of this chabura, part of this community. And I want to end with a tefillah that we should all be able to take the difficult things that we've lived through and sometimes are still going through, and like the title of tonight, to be broken open and to be able to touch healing by going through, on one hand, the big picture of our people, of our lives, of all the parts of who we are and the things that we go through, and to put it into context, but also to feel the brokenness, and through that to be able to get through it as well, and then hopefully with all of our hearts being healed together with these type of evenings, we'll be able to be zeicha to the ultimate healing of our hearts with the ultimate healer, with Mashiach, who's going to heal all the brokenness and Hashem take us home together. Thank you.
Amen.
Thank you so much. But we'll see you next week, August 17th, with Rabbi Avichai Cohen. Good night, Dr. Binyamin. Thank you so much again.
Thank you.
Thank you very much.